Is Dr. Camille Moore. Long-standing history and investigation into swine systems, education from University of Montreal Vet School, and been involved with the industry for over 45 years. One intriguing thing he mentioned, and I kidded him on it, that he wrote that he's an actor and witness of the industry. And so I think we're expecting a good performance from Camille. So thank you, Camille.
Thank you, Tom. Pleased to be back to the Leman conference. Prior to start, I would like to acknowledge my partner in this project, Laurie and Francois. So a quick outline to start with. I'll tell you a bit who we are, why we did this project, the project itself, and cost and return of the project. So who we are, it's the Robitaille family, who is a second and third generation of a company in agriculture involved in cropping, feed mill for their own use and to retail feed, turkey, poultry, hatchery, swine production, packing plant, and further processing. We are totally integrated, producing on the pork side, totally integrated, producing niche product for the Asian market, so heavily marble pork, vacuum pack, and all of the cuts are done under the Asian specification, so bellies are shortener, the ribs meat still on the bellies sold the vacuum pack. So that's our niche market. We're killing roughly 600,000 pigs a year production, producing internally 450 and 4 independent suppliers. So we're a drop of water within the North American swine industry, but we're still alive and we enjoy our business. Why this project? Well, back in 2019, there's a rule in Canada where loose housing it would become mandatory in Canada by 2024. This has changed since then, and now it has been postponed to 2029. But basically, we had to convert all of our sow herd by 2024. To do so, our approach was to do a total depup of our sow herd at the commercial level. And so we thought at that time that it would be a nice opportunity to improve the health status of our system. And when we're talking about health status, we make a difference between the sow herd and the contract nursery and grower. This is a picture of each dot is sort of a swine production premise in Quebec, and we're located here where you see piles of dot. So we are in a very, very dense production area. This is where we sit. And even though if I'm dreaming about putting a filter at the sow barn and all of that, our main problem is excuse me, our main problem is the health status at the nursery and grower, because even though if I'm producing PRRS and flu-negative piglets at weaning, they got contaminated in nursery and finisher by lateral contamination, same for myco. And when that did happen, our main losses are truly related to the secondary invader, Actinovirus suis, Glycerol suis, Strep suis, and all of those bacteria. So even though if I clean the sow herd, put filter, avoid viral contamination, I'll move those pigs to unsecure location and they'll get infected and we will face a lot of problem with those bacteria. So, going back to the ASUS, it's a very bad one because that occurred towards the end of the finishing stage and you're losing 3, 4, 5% of your pig Contract grower got tired of pulling out those big pigs. Feed conversion goes away and all of that. So that was really one that we were very unhappy with, if you wish. We were using, and still using, PIC female. We were pleased with it. We did investigation for our repop of other genetics, and we did find cleaner health status, but we weren't totally happy by the other characteristic, and we weren't happy with the current Canadian PIC health status related to those bacteria. I'm not talking about the main disease. So our thought was, well, if it's difficult or almost impossible to control viral contamination, and if I'm unable to do virus elimination, why should not looking at doing bacterial elimination to help us in face of virus contamination? So we had a meeting in the fall of 2019 at the PIC office in the US, and we showed to PIC that slide. Our dream would be to sweep away A. suis, Strep suis, and H. parasuis from the PIC genetics. And if your motto is never stop improving, we think that should be related to health status as well. It was not totally well received, but we pursue from there, and that's probably why Perry presented the other project a few minutes ago. But that was the start of the thinking. We did look at different alternatives to clean the herds, and PIC was looking at a project that Perry described, but that was not suiting our timetable for our depop repop. So we finally decided to be safe and go with a real conventional caesarean-derived, colostrum-deprived project to do our population. So the project, basically, we did the CD pigs to populate the nucleus farm that will populate 3 multiplication farm that we will use to do the population, or the repop of all of our commercial farm. I have to admit that we have the advantage of being a small system. This would be much more difficult to apply on a larger system, but that's what it was. So we basically moved the 148 pregnant sows from Western Canada to our location, more than 2,000 miles away, picked those animals for their genetic component and their health status. We did the 108 C-section. Well, we basically did the 112, but lose a couple uterus. We put our sows on altrinogest at 112 days of gestation to keep them in gestation until 117 days to produce bigger piglets. We did 8 to 14 sows over 2 days every 4th week, and we did 10 batches. We produce 650 female, and we retain 506 at 20 days of age. So that was the equivalent of a 22% pre-weaning mortality. We were quite pleased with that. And it's quite interesting to see that from batches to batches, just like in normal production, we had quite a bit of variation. The main problem is E. coli scour. Keep the milk line clean in a room at 90-degree Fahrenheit. It's a big challenge. But so that's what we did. A quick slideshow of the C-section procedure. So we had a garage we had a garage attached to a poultry farm far away from pig production. So we had a dirty side with our surgery table and a wall between the clean and dirty side with water bath with iodine to flow in the uterus. Anesthesia, that's the epidural, that's the tricky thing in the entire process. Scrubbing, and then remove the uterus, push the uterus back to in the water bath. People on the other side that receive the uterus to get the pig out of the uterus very quickly. Clean the piglets, attach nipple, and then as soon as we can, we tube the pigs with bovine dry colostrum, and we did that every 2 hours for the first 48 hours, well, 24 to 48 hours, just until the time that they would suck by themselves. Keep the pigs during the course of the day, kept the piglets on site to do only one movement to the piggy deck facility. We had a cutting weight of 850 grams, so the small ones were weight, and we discard the one that weren't weighing at 850 grams. That's the piggy deck filtered station, so the deck, and that's the milk system, so hot milk that is delivered to by 2 cups, so just like producers are using to save extra pigs, so they were, that's what we did use. And if you look at those charts, we were weighing the pigs every day for the first 3 to 4 days to see how it went, and it's just amazing. If you're looking, the weights are in kilograms, so that's 900 gram, 110 gram, 135, so the growth is quite good. And we had a few pigs that weren't getting any weights, and those ones were discarded. Then those pigs were moved to nursery, to grower, and finally they became sows. So like I've said, we saved 506 pigs at 21 days of age. Out of that, we made a little bit over 300 female. We had 100 surplus. That was planned upfront because we did have no queue of our losses. So we wanted to make sure that we would have all of the pigs that we need for our population. And out of those mated female, we populated the 260 sow nucleus herd. For us, the piggy deck was the quarantine. So we had a testing protocol prior to getting out of that section. So with each of the group, we kept a few boars with the female, and at 14 days of age, we killed 4 to 6 per batches. We collected blood, tonsil, nasal swab, and joint swab. And we did the PERS and MICO just as a security. The source herd was negative for that. Strep suis PCR, serotype 1, 2, 9, and 14. GPS PCR, serotype 1, 4, 5, 12, and 7. A-suis PCR, and culture for GPS, well, focusing on GPS and Mycoplasma iorinus. That's all of the tests were performed at the St. Tyson's Vet School by Dr. Gottschalk. So, result, 9 batch were totally negative. 1 batch was suspicious. They were moved to another trailer that we had close by. Retest, they were finally negative. And we did a bit of investigation there to find out that when the vet performed the necropsies, all of the necropsies were done outside of the farm. His necropsy kit wasn't totally clean, and we had some sort of cross-contamination. So that told us that the testing seems to be sensitive, and clean your knives. So where are we now? We're done with the CDCD. All our nucleus and multiplication farms are batch farrowing every 4 weeks. So we have 28 batches that had farrow at nucleus farm. First multiplication, 14 batch, 7 batch. The last multiplication unit is due to farrow next week. And we have of now 2 commercial herd that had been populated, and they had started farrowing in the beginning of September. All other routine testings are negative so far, and I've been asked to present some production data, but we don't have any yet. So the sole thing that I could say is that for pure line female, at the nucleus level, weaned to market average daily gain, if you wish, or at 275 pounds, we're between 1.7 and 1.85 pound per day, which is slightly above the normal PIC growth curve. So this seems to grow well. Now, what's the cost, and could we expect return from a project like this? All of the costs that I'm going to present are in US dollars. So I did our cost in Canadian currency converted to US dollar, but I did not do any adjustment for feed price and all of that. So those prices are probably slightly higher than what you would encounter here. So procurement of the, procurement of the, so the overall, and the cost is the cost to produce a 21-day-old piglets, because I could have bought replacement for my nucleus from the breeding company, weaners at 21 days. So the total cost, $500,000, donor procurement and hauling, $105K, C-section building and operation, $45, quarantine, piggy deck building, supply and the power, eating and all of that, $110, milk and feed, $50,000, vet and management of the project, $70,000, staff for the C-section and the piggy deck section, $52,000, testing, $55K, and drug, we hyper-immunize those animals with a lot of vaccine and all of that, so $13,000. So it's totally stupid for a 300 female mated. I paid $1,666 per mated female at weaning instead of $100. But if our commercial flow maintain bugs-free free status for 3 years with our production of, so that's mean 1,350,000 pigs, our cost per pigs is going to be 37 cents per pig. It's roughly the cost of one Draxon dose at weaning for a pig, procedure that we do quite often in those herds. I have to say that maybe the big challenge still ahead of us, because cleaning old facilities and the management of two pyramid of production of different health status for a while is a big risk. So we're not done yet. We still have a big way to go, but that's where we are. Another way of looking at return, if I reduce my pre-weaning mortality in those commercial herd by 2%, I could save 60 cents per pig. Wean to finish mortality of 1.5% at $1 per pig. Feed efficiency improvement of 0.03, $1.50, and that is high for US perspective, but that's our cost. Average delegate improvement, 0.09 pound per day, 35 cents. Drug cost reduction, $1. So I have a potential saving of $4.45 per pig produced, and I think that I'm conservative. So if we maintain our advantage 8% of the time over 3 years, which is not that big, we break even. All of that is a matter of risk, and we know, but this is just like swine production. Swine production is a risky business. Thank you, and with that, I will entertain any question.
Questions for Camille?
Hello, thank you for your talk. Congratulations. The question is, how was the percentage of survival of colostrum-deprived pigs? And how many people was involved in the pig production, the colostrum-deprived pigs?
Well, percentage of survival is, like I said, we lost 20%, 21% in the piggy deck, and lost 7 or 8% during the grower phase. Those animals, the first generation, they were much more fragile than other pigs. Afterwards, I mean, within the nucleus herd, we don't see much differences, but those pigs were more fragile, that's for sure. And I didn't get your second question.
How many people was involved in the process to feeding the animals?
To feed the animals?
Yeah. How many pigs?
How many person was involved?
How much labor?
How much labor? We had in the piggy deck, we had a full-time staff for the first 24 hours a day for the first 3 days. After that, this was just normal, you know, going in the morning, going in the afternoon, and that's all.
Thank you.
Okay, we have another question over there.
Is this on? Okay. Thank you for the very good presentation. What are your thoughts on any kind of aerosol transmission, or what are your thoughts on keeping these pigs clean now that you have them there, because you are in a fairly dense area?
Okay. We know that we will get contamination, but we don't think that we will have all of the herds contaminated all at the same time. We are quite confident. Our sow herd are very well located, so we think that we could keep that out of the sow herd. And nursery and grower are all in, all out per site. So if we ever get contamination of those bacteria, we'll be able to get rid of at the end of the group. My analogy is always the same. I mean, you do a good day of work, you take a shower, you feel very comfortable, but the sole thing that you're convinced is that you will get dirty sometime later on. So we just reset the clock, and we know that we're going to have contamination, but hopefully we could keep the advantage well enough to not only break even, but get some benefit out of it. And our system, I mean, our herds were 25 years old, so they had a huge legacy of many contaminants.
Camille, your title was Reasons for Conventional Approach for Bug Elimination. What do you want to leave the most important reason for using this conventional, expensive approach? What do you think is the most important reason?
Well, I've just said that our herds were probably 25 years old, yeah. So we probably not intend to go through that process within the next 10, 15 years. So let's do it the safest way possible to start with. That was our conclusion. We looked at many alternatives and finally said, well, let's do it the right way and leave with it.
Perfect. Good way to end. Thank you very much, Camille. That concludes our session. Before we go, let's give all three speakers a great hand for a great session.